Here you see the first classification, upper respiratory tract disorders. It includes common cold, sinusitis, pharyngitis, tonsillitis, laryngitis, epiglottis. And second, lower respiratory tract disorders. It includes bronchitis, bronchiolitis, pneumonia, tuberculosis, lung abscess, emphysema. And third, chronic respiratory diseases. It includes chronic obstructive pulmonary disease, emphysema, asthma, bronchiectasis. And fourth, restrictive interstitial disorder. It includes pulmonary fibrosis, sarcoidosis, pneumoconiasis. And next, vascular and pleural disorders. It includes pulmonary embolism, pulmonary hypertension, pleural effusion, pneumothorax, hemothorax. And pediatric and miscellaneous disorders. It includes croup, respiratory distress syndrome, sleep apnea, acute respiratory distress syndrome, lung cancer, COVID-19. So let us discuss here one by one the exact meaning of these disorders. First one, the common cold, also called rhinitis. It is a viral infection which is characterized by sneezing, runny nose, and sore throat. And sinusitis, inflammation of the sinuses, called sinusitis. And the symptoms are facial pain and nasal congestion. Inflammation of the throat or pharynx, called pharyngitis, causes sore throat and pain while swallowing. And infection and inflammation of the tonsils, called tonsillitis. Inflammation of the larynx, called laryngitis, that cause hoarseness or loss of voice. Swelling of the epiglottis, called epiglottitis, that can block airflow, and it is called medical emergency. Next, inflammation of the bronchi, called bronchitis, which is characterized by cough and mucus production. Infection of the small airways, bronchioles, called bronchiolitis, common in infant. Infection of the lungs causing inflammation and fluid-filled alveoli, called pneumonia. Tuberculosis is a bacterial infection which is caused by Mycobacterium tuberculosis that affects the lung. And localized collection of pus within the lung, called lung abscess. Collection of pus in the pleural cavity, called emphysema. Then chronic respiratory diseases. Here, long-term obstruction of airflow means chronic bronchitis and emphysema together, called chronic obstructive pulmonary disease. And damage to alveoli causing breathing difficulty and poor oxygen exchange, called emphysema. And chronic airway inflammation with wheezing, breathlessness, and coughing, called asthma. Permanent dilation of bronchi due to repeated infection, called bronchiectasis. Scarring of lung tissue causing stiffness and breathing difficulty, called pulmonary fibrosis. Inflammatory disease causing granulomas in lungs and other organs, called sarcoidosis. And lung disease due to inhalation of dust, example coal and silica asbestosis, called pneumoconiasis. And blockage of pulmonary artery by blood clot, called pulmonary embolism. High blood pressure in the pulmonary arteries, called pulmonary hypertension. Accumulation of fluid between pleural layers, called pleural effusion. Air in the pleural space causing lung collapse, called pneumothorax. Blood in the pleural cavity, called hemothorax. Viral infection causing swelling of upper airway in children with a barking cough, called croup. Respiratory distress syndrome seen in premature infant due to lack of surfactant. A repeated pause in breathing during sleep, called sleep apnea. Sudden severe lung inflammation causing respiratory failure, called acute respiratory distress syndrome. Uncontrolled growth of abnormal cells in the lungs, called lung cancer. COVID-19 is a viral infection caused by SARS-CoV-2 that caused pneumonia like illness. Thank you all.